typically we need to know what we're testing for before we know what the best test is. And so genetic counselors are there to help families, we take a full family history, personal history, and we help them understand what their options are for testing and what testing can and can't tell them. So genetic counseling is really the conversation that happens before an actual genetic test. And sometimes people will come in for genetic counseling that actually wouldn't benefit from genetic testing because whatever they have is not something we can detect on a genetic test. And so sometimes just the counseling part is kind of talking through recurrence risk based on other data, or talking through something in their history that they're concerned about. Sometimes it's combing through these feelings of anxiety or of guilt because of something that's in a family. So the counseling usually can happen before and after a genetic test. So after is going over results, but in some cases, it just happens after. And so there's different models of genetic counseling, but the counseling itself is really everything surrounding the test. And then the test is very simply just a collection of either blood or saliva or whatever tissue we're looking at, and then sending that to the lab. And the lab analyzes the sample to look for whatever it is we order.